So we had a great year this year with our fellowship here at the Bitar Cosmetic Surgery Institute, and I would like to tell you about it. I'm Dr. George Bitar. I'm a board-certified plastic surgeon here in the metropolitan Washington, D.C. area. I have done 2 aesthetic fellowships, and then I felt the desire to train fellows so that they can go and teach the next generations of plastic surgeons.
Hi, I'm Dr. Cassie Nghiem. For the past year, I've been an aesthetic fellow at the Bitar Cosmetic Surgery Institute.
Hello, good to see you again. This is Dr. Nghiem. She's our fellow, and we're going to be doing your lecture. Our practice has been around now for about 20 years. We have a state-of-the-art surgery center, a med spa under one roof. We have about 27 employees. We have about 35,000 patients, and we have done about 20,000 surgeries in the last 20 years. So we've been around. Because we have our surgery center, our med spa, everything is happening under one roof, it's a great place to train as a fellow. There's a lot going on, and you'll learn a lot. Dr. Nghiem, let's go. We have a breast reduction to do.
Let's do it. So this patient's already been seen in consultation with Dr. Bitar. She's been marked and prepped, and now she's on the OR table, and we're gonna just get ready to start.
Our fellowship is 1 year for a board-certified or board-eligible plastic surgeon who wants to enhance his or her skills as an aesthetic surgeon. And we got all the secret sauce here under one roof. Let me explain. So for starters, we are the only ASAPS endorsed fellowship in the Washington, D.C. metropolitan area. And this is a beautiful place to live. It's a beautiful place to practice. We have a great diversity in the patient base. We have a great diversity in the staff. And we have a great diversity in our surgeries.
I was looking for a fellowship that was a little bit more face heavy. I think one thing that, at least in my residency, I didn't get a lot was rhinoplasty. So that was one of Dr. Bitar's favorite procedures. So it was nice to see how he did it. I think every surgeon has different techniques. It's nice to pick up little pearls from everyone you learn from. I assisted Dr. Bitar in performing around 40 rhinoplasties. So from here, I'll just be assisting Dr. Bitar in a breast reduction. So here we go.
To be specific, our last fellow did 168 facial cases, 41 rhinoplasties, 84 breast surgery cases, 95 body cases, and 72 liposuction cases. And they are done with me, and basically the responsibility is gradual. As the year goes by, the fellow does more and more operating, and I will be doing more and more observing and critiquing the fellow.
What I enjoyed was interaction with the patients. I mean, I think at the end of the day, it's the patients that make you want to go in every day and try your best every day. And so I've really enjoyed that, and the staff all here is wonderful. I think the benefit of having an in-house surgical center is that the staff really caters to the surgeon's specific needs. Everyone knows their role, everyone knows the operation in and out, so it just makes the day really smooth.
So one of the things that our fellows have said was very strong in this fellowship is our emphasis on marketing, because in modern day cosmetic surgery, if you are not good at marketing your practice and not good at differentiating your brand from the other thousands of brands out there, you cannot be a successful plastic surgeon. That's the reality. So we do teach our fellows, on social media, how to write a press release, how to create content for blogs, for our website, for Instagram, for Facebook. And so therefore the fellow, when they get out of here, are very much in tune to what they want their brand to be, what they want their message to be to their potential patients, and how do they want to be perceived as a cosmetic surgeon, and how to separate themselves from the rest of the people who are in their marketplace.
In a cosmetic center, I think you learn, not only the surgical aspect, but the way to run a business, social media, marketing, how to make a patient feel welcome, and of course the med spa component, which a lot of fellowships don't offer.
Our med spa is a beautiful med spa adjacent to our surgery center. So everything is under one roof, and there's a lot of interaction between the patients, the staff, the fellows. It's just a very vibrant atmosphere. And in the med spa, The fellow learns about skincare, which we have our own proprietary skincare, about all injectables, and we have a PA injector who is a national trainer for doctors and nurses. They will learn about our non-surgical body contouring devices, our lasers, and how to package those, how to give patients choices between non-surgical body contouring and surgical body contouring, and that will be invaluable for a plastic surgeon starting their own private practice.
I would say that, this year is really a landmark year for you. I think it's really important to look what is the best fit for you, interview as widely as you can, get a taste of the program, because this is going to launch your career for the future. Now that my fellowship's ending, I'm joining a private practice in Washington, D.C. I think I enjoyed being a part of a lot of the surgeries. I think that you come in as a plastic surgeon, but it's always important to develop little pearls and tricks along the way. So I don't think I can say there's a favorite surgery. If you do a fellowship, you start maybe about 5 years ahead of the game. You just pick up little pearls, whether it be surgical, whether it be practice management, and you get a little more exposure that you normally wouldn't get just in a hospital-based residency. I want to be able to do it all, at least in the beginning. I love reconstruction, and I spent 6 years training in reconstruction, so I think I'll still keep that piece, but I'll also do a lot of aesthetic surgery as well. I want to say thank you very much to everyone at the Bitar Cosmetic Surgery Institute, and to the next fellow, really just enjoy the ride.
The proof is in the pudding. Our fellows are very successful after they're done here. They've been able to have the practice that they wanted in the way they wanted to practice, and that's what a fellowship is about, is to give you the knowledge and the tools to be able to practice aesthetic surgery in the environment that you want and in the way that you want it. And I think we've been very successful in giving our fellows the tools to do just that.